Let's go ahead and restore this section. So I'm going to put some bond down, and I like the glass ionomer if I'm going to be putting a crown on the tooth. If I'm not going to be putting a crown on the tooth, I prefer a flowable material. I prefer the bulk fill material, but I prefer it to be actually in a flowable state. And the reason is I don't want to put too much pressure on this matrix band to push it away from the tooth after we've worked so hard to get it resting up against the tooth. So with a flowable material, it's in the glass ionomer flowing into that preparation. I don't have to push it down into that preparation, and that makes my life easier. It just has a higher polymerization shrinkage percentage, and so I stay away from flowable composite for that specific reason. I don't like to worry about the polymerization shrinkage, and that's another reason why I like glass ionomer is it doesn't have that polymerization shrinkage. Your traditional composites are the bulk fill composite that I'm using is at 1.5%, so it's very similar to your traditional composites, and I don't have a problem with using that. For this demonstration, I'm going to show you with this flowable just because it is going to be the most similar thing to what I typically would use, which is that bulk fill material or that glass ionomer. And you can use normal composite. You're trying to recreate the dentin. Now, what you want to do before you cure this is make sure none of that flowed up over your matrix band, because that's going to be a big problem. So if you want to take a little instrument and just make sure that you didn't get any of that to flow over your matrix band, you want to make sure it's fully adapted to your gingival or your interproximal walls and everything like that. Now I'm going to cure this. You've essentially elevated your margin to a more supragingival position. To take this off, grab it, go in reverse. Then you can either keep going in reverse and it'll pop off, or you can outward tension and then reverse and keep the tension as you're reversing, and that will help.